Hi, I'm Dr. Lawrence Eichenfield from the University of California, San Diego and Rady Children's Hospital, where I'm a professor of dermatology and pediatrics and run the pediatric dermatology group. And want to talk about my Maui dermatology acne presentations, sort of big summary points of what we discussed, really based around clinical questions that we face in practice. The first is the issue of young teen, question that the family brings up in relationship to planned isotretinoin use, is concern about the impact of isotretinoin on height. You know, you have a 5'4", 15-year-old, they expect him to be 6'2" because that's what they say. No, and they want to know whether isotretinoin is going to have an impact on the height. And there's some very good studies that inform us, new studies that came out in the past year. And I discussed both this database study using the Trinex, the database, really well done study looking at adult height, and then in patients who had isotretinoin use, as compared to those who are on doxycycline and not isotretinoin. And there was another different paper which was sort of a cohort study, so more like a prospective study, though in this case it was a retrospective cohort of this big study done in Rochester, Minnesota, that similarly looked at patients with acne, looked at their adult height, looked at their time period, during a sort of vulnerable time period of taking isotretinoin, and looked at both height velocity and difference in adult height. And both studies come to the conclusion that there's no impact of isotretinoin on minimizing height, nor a higher representation of short stature with drugs. So very reassuring information. Also discussed courses of isotretinoin and what predicts a need for isotretinoin, or the other way of looking at it is who's at risk for needing another course of isotretinoin or recurrence of their acne. And females have a higher risk of that, but the study basically said that it's not how much Accutane you take per day, it's generally a cumulative response. If you're in 120 to 220 milligrams per kilogram total, you'll have less chance of having a relapse or a need for a second course of isotretinoin. But if you're above 220 milligrams per kilogram, there's no additive benefit beyond that. And then lastly, I discussed what'll be a new article coming out from the Pediatric Dermatology Research Alliance that looked at the use of oral contraceptive in younger teens under 16, coming up with what will be guidelines for recommended use of OCPs, with probably the biggest takeaway being the consideration of not using oral contraceptives in patients under 16 till 2 years after their start of menarche. And that's because a lot has to do with bone mineral density and the acquisition of bone mineral health. And that's for acne if they don't have other reasons to use oral contraceptives. It could be because of polycystic ovary disease, dysmenorrhea, abnormal uterine bleeding, other conditions of contraception itself, where you could use it in a younger age. But for acne alone, that recommendation is one, I think, based upon maximizing bone health over time. So a few interesting things that I think are helpful in our clinical practice for taking care of our patients with acne.